Why, hello there. Welcome to the eye examination room. Understood. You are here for an appointment. Lovely. Please do make yourself at home. Come on in and take a seat at the chair in front of me. Thank you. So, welcome to the sleep clinic here in Dream City. And were you called over here after a basic general checkup? Okay. I'm going to be writing that down. Could I get your first name? Thank you. And I know the front desk gave you one of the patient wristbands. Could I get your patient ID number? Thank you. So it's 678 999 8212. Thank you. And a nurse has seen you, right? Yes. You've had a full medical checkup before this. And did they put the notes on you to measure your heart rate and your temperature? Lovely. So those are already applied. We will be assessing your health through those as well. Good. And you're all entered in here. Taking a close look. Looks like you scheduled yourself for an unpredictable eye examination, correct? Yes. On your report, it does say that you are very fond of eye examinations for relaxation and sleep, and that you've been lacking on some good sleep recently. Is that correct? Good. Well, good to know. I'm here to take care of you. I am Dr. Luna, and I'm the ophthalmologist and ASMR representative here. Yes. So, shall we begin? Have you had any troubles with your eyes? Falling asleep. I see. So, I'm going to ask you, if I may, very carefully, just trace around your eyes. Today we're going to be performing a lot of exams and a lot of ASMR that will help you relax, okay? Good. If you feel uncomfortable at all, let me know. Wonderful. So, we're going to first just press around the eyes, okay? And you do have beautiful eyes. Let's begin the exams. I want you to follow my finger. I'm going to get close. We're going to measure field depth precision. So, okay. Wonderful. Okay. Wonderful. Okay. 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 Now follow my finger. I'm going to place it to the center of your nose. So very carefully, just going to there. Wonderful. Once more. Perfect. And try your best. Great. Good. I'm next going to apply a melatonin cream around the eyes. It has lavender oil, and it will help you fall asleep. Yes. We're then going to add some eye drops and do some eye exams. Okay. Good. So, very carefully, just going to place it around your eye. Look up for me. Thank you. next going to add an eye dilator drop. After a minute or two, we will begin light pen examinations. So, and just going to, okay, blink. And blink. Good. So, now, letting that set in. So now for depth perception test. Looking at your eyes, it looks like they're dilating perfectly. I have this Q-tip with a red top, and I want you to tell me about how far away you think it is. Good. So, I'm going to cover one eye first, and just follow the dot. So, how far away? Okay. 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 Very good. Okay. 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 And do you see any double vision? Okay, vertigo? No. Great. Now let me know when it comes into frame, when you see the red dot. Okay. 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 Let me know when it comes into frame and then when it leaves. Okay. Wonderful. Okay. Wonderful. Depth. How far away is that from you? Okay. Perfect. Perfect. Other eye. So, how far away is it from this eye now? Going to very carefully just. Okay. 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 Now let me know when it comes into frame and when it leaves frame. So, very quickly just going to assess. Okay? Okay. 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 Perfect. Okay. 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 Great. Now, we're going to do something that requires precision. I would like you to follow the light, and when I say look at me, immediately look into my eyes, okay? Good. So, very carefully follow the light. Look at me. Don't look at the light. And look at the light. Now stop, look at me. Do not look at the light. I'm going to shine it into your eyes a couple of times. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, southeast, southwest, look north, look northeast, look up, down, left and right. Perfect. Now to the other eye. So far, are you feeling okay? Good. Do you have any vertigo? Nope. Double vision? No. Any eye strain at all? No. Good. I do see that your information on the computer is doing well, and that your heart rate is relaxed, which is exactly what we're here for you. And do you feel your eyes getting a bit sleepy and heavy? Good. That's a good sign. I'm also noticing no change between the eye direction for wavering eyes, so it's good. Onto this side. So, first I want you to look at me, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Okay? Bit funnier than 24. So, follow the light. Look back at me. Follow the light. Look back at me. Follow the light. Look back at me. Perfect. Gonna get a bit up close now. Beautiful eyes, I do say so myself. So, look up. Look down. Look to your left. Look to your right. Look again to your right. Center. Up. Down. Center. Left. Right. Look northeast. Look northwest. Look southeast. Look southwest. Look east. West. North. South. And then up to the west. Look down. Okay, look back at me. Perfect. So I'm going to do that now. Now, we're going to do something called follow the light. It's a bit different though. Follow the light and you tell me what shape I am drawing. Good. This is a neurological test to see if your eyes are working with your head. So, okay. And what is that? Triangle, perfect. Moving on. Okay. Okay. And what is that? Circle. Okay. Good. Okay. What is that? A square, it's close. It's actually a rectangle. Okay. Now look at me. Don't be distracted by the light. Good. Don't be distracted. Don't be distracted. to measure optical nerve. I'm going to flash this light a couple of times. I want you to count how many times you see the light flash. Thank you. So, and how many was that? 21. Perfect. That's very good. Thank you. Next, we're going to do a bit of a different type of vision field test, similar to a Snellen's test, but a bit more difficult. Increased. So, I'm going to actually place this measuring tape along your eye, and I want you to let me know what the last number you can visually see is, okay? So I'm going to just very carefully. What is the last number you see? Okay, 7. What's the farthest number you can see out to, but it's not a bit clear? 11. Great. On to the next eye. Just sit there. Just going to place this around your eye. We're going to tilt it up. Now what about for this side? Do you see any differences? Okay, so 6 for this side. What's the farthest you can look out to? About the 9. Okay. So, next, I'm going to put this about a foot and a half apart. Can you read these numbers back to me that you can see? Yes. So what's the number on the farthest right? Good. On the farthest left? Good. What's the number in the center? Perfect. A bit closer now. Did this get blurry at all? No. Double vision? No. Okay. So, I'm going to actually put it to the bottom of your chin. Any difference in vision, or is it the exact same? You can see farther out. What's the farthest number that you can see out to? 15. Okay, what's the clearest number? 5. And what's the number that's in between the two? 10. Perfect. Very good. Next is the color test. Do you have any color blindness? Okay, we will test anyways. So far, your eyes are working well, but it does appear that your eyes are a bit slow. And this could be because you're very tired. In fact, your heart rate is matching up with tired, so we're going to actually assess that as well with a color theory test. You tell me what color you see, okay? Good. So, first on the list. What is this? It is green. Good. Do you know what this is? Pink. Wonderful. How about this? Red. Good. And what about this? Blue. Perfect. Now we're going to switch the lights. I want you to remember what tone this is, okay? We're going to change the colors now with the room. You let me know what the color we change it to is. Perfect. So we will begin with this one. And do you know what color the a quick test here. Just going to see if you flinch. Okay, good. Thank you. Eye ability increased. Perfect. Next up. What is this? Okay. So, perfect. This is also green. Green has the ability to make things appear a bit more serene. I am looking as well at the statistics for your heart rate, and it does appear that your heart rate is the same as prior, so no effect. Do your eyes feel calmer with this light? No. Next color. Yes, this is red. So, red actually is a color that can make people sleep, or it is the color of love. Similarly, it should remind you of sweet fruit, strawberries, and apples, which should remind you of warm summertime. So, this color appears to be dropping your heart rate, so red. Okay? And your eyes appear to be adjusting well and slowing down. Perfect. Next color. No, it's not the first. What color is this? It's purple. And heart rate a bit increasing with this color. And your eye function is as well increasing a bit. Continuing on. Any idea what color this is? Yes, this is indeed pink. And are you seeing the same for the finger size, or is there a difference? Okay, so depth is fine. Good. And then, was this the same color as we had when we began? Okay, what about this one? Okay, what about this one? Okay, so 1 or 2? Which one do you prefer, 1 or 2? 2. Perfect. So, looks like we changed colors. Unable to adequately assess the color change from yellow to orange, but preferred warmer color when chosen between the two. Okay? Last but not least, I'm going to do one quick test with your eyes. We're going to go from the side of your eyes, and I'm going to do something called eye cupping. It is sort of like just opening your eyes very carefully. Okay, so first, we're going to do the boundary between both of the eyes, just like this. Going to cover your eyes. Then we're going to open the eyes again. Okay. Perfect. You appear to be getting tired, so covering the eyes. I have assessed which ASMR and eye exams you like the most based off of heart rate statistics and body temperature. And it appears that you like visual ASMR that is close to the face and relative towards your health. So, eye function as well appears to be of someone who is tired, and you deserve to get some really good sleep. I do hope you get some really good rest tonight as well in the clinic. So, eye dilation lagging because of tiredness, and overall eye depth perception is the same due to tiredness. Okay, so now we're going to let you go back to your clinical room and let you rest, and we will curate a video specialized towards the ASMR that you enjoyed. Okay? Sound good? Wonderful. Just relax. Go to sleep and have an amazing night. Again, I am Dr.